So we talked about the Zhongfeng a little bit. I mean, the issue with Zhongfeng is you're working with a more deficient person. So you just are doing more things that build up. It's like they say it's a disharmony between yin and wei. And really it's like the yin isn't coming up to support the wei qi, right? Because they're never really fully, I mean, the yin and wei are separate qis, right? They move in separate places in the body. Like the wei qi, I was talking about this last week, where the wei qi is completely avascular. The wei qi never touches the blood really. And then the yin qi is moving in the blood. So it's like your vascular system versus your interstitial system, the interstitial fluids and everything. So the disharmony is really that you're not having enough nutrients moving up to like generate wei qi. So it's like, okay, they just don't have enough wei qi to actually push it out. Or maybe it's some deficiency of the immune system or something. But yeah, the person tends to be presenting as more deficient, or at the very least, despite the fact that their body is trying to expel some pathogen, it won't expel it. So you're just doing more tonification there. So you're using Gui Tang as the flagship formula, and you're doing more tonification. And then when it starts to transform, I mean, when you start to get Shaoyang issues, then, I mean, Shaoyang is also really popular now because Lyme disease, long COVID, all these things are Shaoyang issues. So with Shaoyang, here, the main thing is you're seeing intermittency in the symptoms. So intermittency is the primary calling card for Shaoyang disorders. So this happens with the fever. So you have intermittent fever. So tidal fever. That's why malaria is like that's why they call these like malarial disorders, because the primary way that you know you have malaria is because you have that tidal fever. But intermittent fever, this happens with gastrointestinal stuff. So you get alternating loose stools. Let's see. So alternating loose stools and constipation. And constipation doesn't mean, in this case, you have hard stools or big bulky stools. It just means you're not having a bowel movement. And with the fever, they'll say alternating fever and chills, but really normally it just means you have a fever and then you don't, and you have a fever and then you don't. So it's like when people feel good certain times of the day, and then the other part of the day they don't really feel so good, and it's regular. It's like it's coming on like that. And then you also see intermittency with like pain patterns, so like body aches, usually coming with a fever. So you have intermittency. That's the main thing that you use diagnostically to tell you have a Shaoyang disorder. But with this kind of thing, we're thinking about modern day, we're thinking about like chronic viral infections. In the case of like Lyme disease, it's a spirochete. And the main spirochetes that we deal with are Lyme and syphilis. And then other than that, it's like you have all the co-infections that come along with Lyme disease people always talk about. So it's things like Babesia and you get like these other types of tick-borne illnesses like Rocky Mountain spotted fever. These are all things that turn into Shaoyang disorders. Herpes, all the herpes viruses are Shaoyang disorders. Well, I'm sorry, we should just say just herpes simplex presents as a Shaoyang pathogen. And you'll see with herpes, it's easy to see that you're getting, the virus is actually lodging in a Shaoyang region of the body too. So it's like lodging normally in like, for the mouth or for genital herpes too, you're getting like the margins of the mucous membrane and the normal skin. So it's in these like one of these kind of marginal regions of the body. Yeah?
Chickenpox and shingles, is that Shaoyang?
No, well, that's herpes zoster. And yeah, and I almost just said all the herpes, but it can. It can kind of present, but normally it doesn't. I mean, it's like maybe it goes into the Shaoyang and stays there forever, kind of for a really long time in its intermittency, you know. I mean, in a way, I mean, it's going to like the base of one of the nerves. It goes to like one of the nerve roots in the ribs, and it lodges there. That's where herpes zoster goes dormant. Yeah, so it goes in, and it's like this is right at the liver region, right? So it's like that's at the, you know, it's kind of like, you know, getting into this kind of Shaoyang-y type pattern, but you don't have like the chronic presentation over time or anything, and so probably not a good case example of it. But
molded exposure that manifested as a Shaoyang.
Yeah, so fungal things can do it too. Is mold fungal technically?
Yeah.
It is, right? Okay. I get yeasts and molds and things and fungi. But yeah, so fungal things. So it's like parasitic things in general. I have one patient that I was seeing for a long time, and she came in and she was just like, my issue is for the last 2 years, I've had a low-grade fever, and it's not gone away. My fever's like 102 every day. And she's like, I feel terrible. Like, I'm completely exhausted. Like, she was like, you know, her chi was totally shot because she had a fever all the time, and the fever burns up the chi. And she's like, I have headaches all the time. I have this fever. My bowels are kind of messed up. My sleep's terrible because of the fever. And she's like, she just can't function normally. And she'd been through the ringer with all the Western medicine stuff, and they haven't really figured anything out. They were like, she's like, I have no idea what it is. And I'm like, it's an infection. Like, it's definitely a latent infection. Like, why else would you have a fever? Your body's like, it's addressing some kind of like chronic infection. And we did a formula with, it was, so the basic herbs that you use for this are Chai Hu based formulas or Qing Hao based formulas. So Chai Hu is the main one, but Qing Hao is when you have more heat. So this is sweet wormwood, Artemisia capillaris. And so Qing Hao is more cooling, and they use it, it's in like clear deficient heat is the category. And normally the formula you'll see in relationship to Shaoyang disorders is Qing Hao Bia Tang. So if you use Bia, I've never actually even taken it. But I gave her a Qing Hao formula and got rid of it in like 3 weeks. And so she'd had it for like 2 years. So Qing Hao, if you look at like, actually they recently extracted artemisinin from this. Artemisinin. So this compound was recently extracted from Qing Hao, and they use it as an antiviral now. In fact, during COVID, they were using it a lot. And it was like, I think the lady that extracted it won a Nobel Prize for like an anti-malaria. It was like a novel anti-malarial drug. So this has lots of anti-parasitic qualities to it. Chai Hu, maybe to some degree, but not nearly like Qing Hao does. So if it's more likely a microparasite, Qing Hao is great, or at the very least you want to like pair Chai Hu with like a bunch of like anti-parasitic things. Heiner talks about like the demon expelling herbs. It's like that kind of stuff. Yeah. But yeah, so it's like this is kind of the presentation. Like when you're looking at Shaoyang stuff, this is kind of what you're looking for, is this kind of thing. And you can see like a lot of this stuff is like, I mean, it's really popular. I mean, like how many people have herpes? How many people have like chronic infections of some kind? Even like Epstein-Barr. You know, it's like how many people have Epstein-Barr infection? It's like one of these things that's like, you know, you get it when you're a kid and it's just like you have it, you know. Most people don't even know they have it. But all these like latent viral infections. And there's a million different ways to address Shaoyang disorders. But usually you're doing like long-term herbal treatment for it.
How do you, because the harmonizing category is what I think of when I think of this.
Right.
How do you, so is it just these sort of intermittency things interlaced with like a spleen 2 deficiency for Shaoyang or a heat pattern for Qing Hao Bia Tong? Or like how do you, is it just, are those all Shaoyang sort of things, or are those just, am I pulling from different sort of?
For herbs?
Yes, like, because Shaoyang, there's a bunch of stuff that treats Shaoyang sort of things.
Right. Right.
Those are all like sort of intermittent in and out sort of things.
Right.
Are they all Shaoyang, or are they different things that just look like Shaoyang?
Well, I mean, the Shaoyang approach is just, it's like a conceptual strategy for dealing with a pathogen which you can't vent and you can't purge. That's like when they say you're doing a Shaoyang approach. I mean, they say it's a pathogen which is lodged halfway in, halfway out. And so the reason that they are doing this kind of harmonizing effect, quote unquote, is because they can't eliminate it the other roots. And in the traditional medical paradigm, whether it be Greek medicine, Persian medicine, traditional like Egyptian medicine, all of them, in the traditional paradigm, you have to have a catharsis to eliminate something. So they're always looking for where is the catharsis. Catharsis means a fluid release, really. You're looking for some kind of catharsis. And they kind of differentiate Shaoyang pathogens as being this thing where it's like, hey, it's lodged in this place where we can't do a catharsis. So they're looking for a way to resolve the disorder by harmonizing. And so when you look at like Xiao Chai Hu Tang as the flagship formula, you'll see it's built where it has some herbs that are acrid. Acrid is venting, right? So it's like if it were Taiyang, you would just be using acrid herbs primarily. So it's got acrid herbs like Chai Hu. And then it has some herbs which are bitter. That would be the approach if you were doing Yang Ming, because bitter is draining for purgatives. So it's got bitter, that's Huang Qin. And then it's got sweet herbs in it. Like, what does it have? Like jujube, right? Yeah. So we've got like Hongzhao, Renshan. But it's got this kind of thing where, what else is in it? Oh, Shangjiang. Is there anything else? Banxia. It's been a long time since I've had my board, so I don't know if this is all right, but I think this is right. But so Banxia and Shangjiang also are acrid. And Banxia also is bitter. And here you have sweet things to help to build up the qi and kind of harmonize. But you have things going up, things going down. And this is the basic idea. This is why Chai Hu and Huang Qin are the two primary herbs in it, because you've got this like, you're creating this like dichotomy where you have a rising and a sinking at the same time. And so you're getting this energetic kind of neutral formula that's kind of interacting with, theoretically it's harmonizing the qi. Practically speaking, I never use this. If someone comes in and they've got a chronic infection, I don't lean on this. So that's why I'm not like a Shanghan Lun practitioner. Practically speaking, the idea is that you just want to focus on like building up the immune response. Like you want to create a huge immune response. Cancer even is thought of, in some cases it's treated like a Shaoyang disorder. Like, did we get all the herbs?
Yes.
Okay, cool.
Gansao,
okay. Almost. Rudolf Steiner, you guys know who Rudolf Steiner is?
Yeah.
He's one of the guys that was on the ground level with like the Theosophy movement. It was like a modern day spiritual revival that a lady called Helena Blavatsky, she was a medium, her and a couple other guys kind of created this movement. And out of this movement was born, maybe Rudolf Steiner was second generation in this, but out of this movement was born a lot of systems, and one of them was like the Waldorf schools. Is it the Waldorf or is it the Montessori? It's Waldorf, right?
Waldorf and biodynamic.
Biodynamic farming. And so Rudolf Steiner had a lot of medical protocols also that he was kind of espousing. And one of those was mistletoe therapy. So you'll see this is more popular in Europe than it is here. But they were very interested in homeopathy, and the Theosophists did more homeopathic approaches. So homeopathic means that you're doing, you're using, you're taking a pathogen that's hot, and you're using a hot treatment to treat a hot pathogen, that kind of thing. So for cancers, they would use mistletoe. And the idea is that you give the person mistletoe, and they actually inject mistletoe concentrate intramuscularly. And it causes the person to have acute flu-like symptoms. So the person will immediately have an immune reaction, and for 2 days they will have fever and low-grade chills and all these things, and they'll have like this kind of like body aches, and they're going to feel unwell. And they do that like every 2 weeks. And sometimes they'll inject it even right at the tumor. So like I've worked with patients, like I was working with a patient that had breast cancer, and she was going to a place in Georgia for this. And they would do this every 2 weeks, and she would take small amounts of the mistletoe orally as well, and she would go get the injection every 2 weeks. She did it for like half a year, and then it got rid of everything. But that is like a Shaoyang approach, because the idea is that you're harmonizing it, because you're not venting it, you're not expelling it, you're just giving the body this huge immune response. You're like putting the body in this state where it's like going into this kind of like big immune response, and you're trying to get at something that's internal. So things like that are kind of falling in, from from my perspective, that's falling into kind of like the Shaoyang type treatment, or like when they'll do these kind of therapies. Another cancer therapy that people do is where they'll do like heat therapy, where they put you in this chamber and they heat the body up to a certain temperature. It doesn't get really hot. You go up to like 103 or something like that, and you stay there for like an hour, 2 hours. You just hang out, and you do that periodically. And the idea is that you're like, again, upregulating all these white blood cells and everything, and you're getting more immune response. So for me with this, I'm doing like long-term immune response protocols. So I'm doing supplements and herbal things that are like immune response stuff. Qinghao is one of the things that I like to use for this because it is a classical herb they use for it, but it's also got all those anti-parasitic properties. I don't know. Do you guys have other things to say about this? Like I said, I'm not a Shang Hanlin practitioner though, so I don't know. I kind of run dry with like talking about it sometimes.